Welcome back. A new report from the CDC this week shows that firearm-related deaths are the #1 cause of death in children and adolescents in our country. To help further break down this report, our 9 health expert, Dr. Pyle Coley, joins us now this morning. Good morning.
Good morning, Gary.
It's a timely report. So this shows that gun-related injuries have overtaken like car crashes, and it's the first time we've seen these numbers, right?
First time ever, Gary, and more than 45,000 kids die from homicide, firearm homicide. Not only are we seeing the highest numbers ever, we're also seeing a really steep climb in the numbers, and steeper climb occurring amongst our kids than occurring amongst the adults, which is also very concerning. And if you break it down by demographic, it doesn't matter what gender you are, it doesn't matter what race you are, we're really seeing across the board kids and adolescents being affected by firearm-related injuries.
And that is very troubling. Do we have any idea why this trend?
You know, there's some speculation that it has to do with the pandemic, the fact that during the pandemic there was, more depression, more anxiety, more substance use. But I think some of it is beyond just the mental health piece of it. Some of it is access. And the reason that we're thinking that is because now that the pandemic is sort of starting to change and life's getting back to normal, even though we're seeing decreases in some of those mental health conditions and the substance abuse, we're not necessarily seeing it go back to pre-pandemic levels with the firearm-related injury. So it's really a wake-up call for all of us. I think that we used to worry about vaccinations in our kids, infectious disease, and we've done a great job getting rid of those, but now we need to start tackling this.
And the report from the CDC also showed an increase in drug usage among kids, right?
That's right, 84% increase in drug use amongst
Wow.
kids and adolescents, yeah. And that, I think, again, reflects some of the pandemic, but some of it actually, and when you break it down by what type of drug use, a large proportion of it was driven by accidental overdoses or poisoning. So a lot of the things we hear about drugs being spiked that our teenagers might be using, or little kids getting into medicine cabinets, alcohol, drugs, those types of things. So I think, again, really important for parents to wake up, hear this news, and start to make some changes at home.
Yeah, and what kind of changes? I mean, what can parents do? What can doctors do to try and reverse this trend?
You know, I think safety at home is really important, whether it comes to firearm safety. So if you own a gun, you have to be sure to lock it up and keep the ammunition separate from the gun itself. If you have drugs around the house, whether those are prescription drugs or recreational drugs like alcohol, again, keep them out of reach of the younger kids. When it comes to the older kids, Gary, it's all about communication. And often parents worry, I think, that talking to their child might put the idea in their head. They bring up guns or they bring up drugs that they're using, but it's quite the opposite. The evidence shows that if they haven't encountered it yet, they will. So talking to them about firearm safety, about drug safety, and opening that door for communication so that they feel like they can come to you when they encounter this, because they will encounter it.
Okay. Boy, like you said, that's an eye-opener for sure. All right. Dr. Coley, good to see you. Thank you.